Hello everyone, I am Dr. Sagar from the Dental Academy. Today I'll be teaching you about the scalp. So before we start, we need to understand where the scalp is and where it is located. So our brain, which is protected by the bony cage which we call the skull, has a thin layer of soft tissue above it which is known as the scalp. So basically, scalp is a soft tissue covering the skull or the cranial vault as we call it. So the topics that we are going to cover today under scalp will be the extent of the scalp, the layers of the scalp, the nerve supply, the blood supply and the clinical anatomy of scalp. So सबसे पहले हम पढ़ेंगे वो है extent of scalp, scalp के attachments. सबसे पहले एंटीरियरली जो कि है फ्रंट साइड, जो हमारा स्कैल्प है वो सुप्रा और बाइटल मार्जिन तक जाता है विच इज़ जस्ट अप टू द आईब्रोज. हमारे आईब्रोज के ऊपर आके स्कैल्प की अटैचमेंट ख़त्म हो जाती है. उसके बाद पोस्टीरियरली दैट इज ऑन द बैक साइड देयर इज द एक्सटर्नल ऑक्सीपिटल प्रोट्यूबरेंस विच कैन ईजिली बी मार्क्ड ऑन अ स्कल, बट टू मेक इट ईजी जब आप अपने हैंड से टच करेंगे ऑन योर ऑक्सीपिटल बोन यू विल फील अ सर्टेन काइंड ऑफ प्रोट्यूबरेंस विच इज नोन एज द एक्सटर्नल ऑक्सीपिटल प्रोट्यूबरेंस विच इज वेयर टिल देयर इज द एक्सटेंशन ऑफ द स्कैल्प. बिल्कुल इसी ऑक्सीपिटल प्रोट्यूबरेंस के साथ सुपीरियर न्यूक्लियर लाइंस पास होती है जो कि पोस्टीरियर साइड पे स्कैल्प की एक्सटेंशन को मार्क करती है. ऑन द साइड दैट इज लैटरली the scalp is extended up to the superior temporal lines जो हमारी temporal bone पे present होते हैं. So here you can easily see that this part anteriorly has the supraorbital margin. Here where the temporal bone is located has the superior temporal lines, and on the occipital bone on the posterior side you have the superior nuchal lines. So this is the entire extension of the scalp in our body. So next we'll be talking about the layers of the scalp. So basically हमारे scalp में 5 layers होते हैं जिसको आप बहुत easily एक न्यूमोनिक scalp याद करेंगे. SCALP नाम में ही इसके layers छुपे हैं. So basically an easier way to do is to remember SCALP. S for skin, C for connective tissue or superficial fascia, A is for aponeurosis, L is for loose areolar tissue, and the fifth layer of the scalp is the pericranium. As you can see here, this is a representative diagram of a scalp. So the first layer is known as the skin, which had the hair follicles and the sebaceous ducts. So you can see these are the hair follicles. This is the second layer, which is also known as the connective tissue, also known as the superficial fascia. This is a very dense fibrous layer and it has the presence of blood vessels and the nerve supply. So the blood vessels, as you can see, the arteries are marked by the red and the veins are marked by the blue color. This also has all the nerve supply that is coming into the scalp. The third layer, which is also known as the aponeurosis, also known as the galea aponeurotica. This layer is formed by the occipital frontalis muscle and its aponeurosis. The fourth layer is the loose areolar tissue, better known as the dangerous area of scalp, and the fifth layer is the pericranium. So first up, in the layers of scalp we have the skin. The skin is the topmost layer of the scalp, which is very thick and very hairy as it protects the skull from the external environment. So हमारी जो स्किन होती है It contains maximum number of hair follicles and sebaceous ducts. It has a lot of sweat glands Clinically, the scalp, since it contains maximum number of hair follicles and sebaceous ducts, it serves as the commonest site for sebaceous cysts. The next layer we'll be talking about is the superficial fascia, also known as the connective tissue. This layer is dense and fibrous, and it has the major function of this connective tissue is that it contains blood vessels and nerve supply. The blood vessels and nerve supply lies in this region of the scalp. So the next layer we'll be talking about is the aponeurosis or the Galea aponeurotica. So this layer is formed by the occipitofrontalis muscle and its aponeurosis. So हमें ये देखने की aponeurosis मेजर पार्ट है इस लेयर का और जो मसल है वो एक स्मॉल पार्ट है इस लेयर की. सो ये लेयर बनता है occipitofrontalis मसल से, जिसकी 4 बेलीज होती है. एज यू कैन सी इन द डायग्राम, there are 2 frontal bellies on the frontal side and 2 occipital bellies on the occipital side. So iske clinically you can say that in the anterior posterior direction there is tension. The aponeurosis is under tension by the occipitofrontalis muscle. So wounds of scalp do not gape until cut transversely. हमें इस डायरेक्शन में there is a lot of tension that is created by the aponeurosis. So the wounds will not gape because this part is stretching and this part is stretching. If we cut it transversely, the wounds can cause gaping of aponeurosis. So the next layer we'll be discussing is the loose areolar tissue. This layer is also known as the dangerous area of scalp. The first 3 layers of the scalp, हमारा जो scalp के पहले 3 layers होते हैं वो tightly adherent होते हैं एक साथ और उनको separate करना बहुत मुश्किल होता है. So loose areolar tissue, it serves as a natural plane of cleavage during craniotomy. The primary function of this layer is to present और एक passage देने का emissary veins को. हमारी जो emissary veins होती है वो कनेक्ट करती है एक्स्ट्रा क्रेनियल वेन्स को इंट्राक्रेनियल वेन से. The 5th layer of the scalp is known as the pericranium. It is the 5th and the deepest layer of the scalp and it is also known as periosteum. Thank you so much for watching, and for more such informative videos please like, share and subscribe to our channel.